Welcome to the Swain Sinus Show, a physician and patient discussion on how to better manage and treat mild to serious sinus issues and conditions. From diagnosis, treatment, home remedies, and surgery, Stacy and Dr. Swain will talk about improving your quality of life, breathing easier, and feeling better. Let's take control over our sinuses and allergies so they don't control us.
Hey, Stacy.
Hi, Dr. Swain. How are you?
I'm good. We're going to change places for just a second here.
I like it.
Because you and I were talking beforehand. For this show, we're going to talk about hoarseness. And we were talking beforehand about all the causes of hoarseness. And I know you have some personal stories to relate to our listeners. And I was wondering if you would kind of share kind of a little bit what's going on with your family.
Yeah, thank you. So about 6 or 8 years ago, my mother had throat cancer and has had part of her larynx removed as a result, and has also had radiation therapy on her throat. And ever since then, she has had hoarseness. And as the daughter, not really understanding the full complexity, I think, of the situation, I always thought, well, the hoarseness will go away. Like, why are you still hoarse?
Right.
And sometimes it's worse, but there is a baseline hoarseness in her voice since that treatment. And I'm guessing it's never going to go away.
Well, I'm glad your mom's okay.
She
first
is,
of all.
yes, thank you.
That is certainly good news. And so I think you bring up a really good point about, hoarseness. And, taking a step back from looking at this, when you first meet someone, the first thing you do, usually, you greet them. You look at them and you're sizing them up, or the first thing you do is you speak to them. Mm-hmm. And a lot of times, I think we take this for granted so often until it's happening to us, is you don't sound like your normal self.
Right.
And that can be so distressing. Mm-hmm. In your mother's case, and thank goodness she's okay, when you're dealing with a malignancy, there's a lot of things that's going on, and it's very complicated. And it sounds like from what you're saying, she had surgery, mm-hmm. and then she had radiation afterwards. And once things have been altered like that, especially depending on the type of surgery and how much radiation she's had, it's hard for things to go back to normal. The goal, obviously, is to get rid of the malignancy, get rid of the tumor, and then the next things are function. Mm-hmm. Are you able to swallow and breathe normally? And the next thing is your quality of your life, your voice. So that's what you're describing is certainly very common, especially in people with head and neck cancer. Kind of taking this step back and talking about hoarseness overall, I think it's just a question of, just like we were talking about beforehand, it all depends on what the history is. And is this a simple problem? There are a lot of causes of hoarseness that are, pretty benign.
Right. I could go to a football game and scream my head off, and the next morning I'm going to wake up with, a hoarse voice.
Correct. And vocal abuse, vocal overuse is certainly very common. I think all football fans can believe that. Certainly parents see that a lot with children, whether they're calling after their children or reminding their children to pick up something, or if they're maybe talking to your spouse about, hey, don't forget to take out the trash, don't forget to take out the trash, don't forget to take out, And so those things kind of happen in life. Vocal abuse is certainly a big cause of hoarseness. Singing. People that are singers, they talk about vocal cord nodules, mm-hmm. singers nodules, mm-hmm. People that use their voice professionally, and then there's always the laryngitis. You got a cold. We talked about sore throat in the last episode. Mm-hmm. Well, if you get a bad sore throat and you get a bad laryngitis, it sounds like you're a frog.
Right.
Or you're almost aphonic. You lose your voice for a week to 10 days. And obviously those things tend to get better quicker.
And in that example, in all of them, I guess it's just either the overuse. Is it an inflammation that's happening that's causing that?
For the people that just have acute laryngitis, you get a cold, you lose your voice. Yes, you get swelling of the vocal cords, you get inflammation of the vocal cords. As the inflammation regresses, your voice gets normal and you go on. For people that are football fans, depending on how much trauma they've produced to their vocal cords by yelling, you can get hemorrhagic changes. You can actually bleed into the vocal cord. And again, most of the time for those people, when they resume their normal type speaking patterns, those inflammatory changes go away. Chronically, for people that sing a lot, they use you have the professional voice needs, you can get little. You can think of it almost like a callus along the vocal cord, and that can restrict how the vocal cord moves. In the office here with the equipment we have, we can show people their vocal cords and they look like they're moving back and forth. But if you can slow it down, if you can look online at one of the pictures of how vocal cords move, it's actually a mucosal wave. And so a callus on the vocal cord will disrupt that wave. And again, a lot of times we treat those people with conservative measures, education. Sometimes we'll get them to see the speech therapist to help them work with how they voice, how they speak. People that are in the military, drill instructors, teachers, when they're trying to reach the last child in the back of the room, trying to get their attention, will tend to yell
or straining your voice.
So you got to learn how to do that properly. And then, of course, we have people that have other issues. Malignancy, you shared that story with your mom at the beginning of the show. That's always a concern, is something that's not getting better. ENT doctors are always, I guess, anti-tobacco. Whether it's smoking or vaping or smokeless tobacco as well, just because it's a known carcinogen. So it kind of depends on the situation, the history, and people can come in with a complaint of hoarseness, and really what they tell you kind of depends on how aggressive you need to be with the exam or what you need to do.
So a couple of other examples we have talked about before is another personal story. My husband snores. And he'll wake up in the morning with a hoarse voice. Is that related?
It can be. I think certainly if you're having trouble at night with snoring or maybe you have sleep apnea, and if you're refluxing as well, one of the things we were talking about beforehand is stomach acid and how common those things kind of tend to run together. If you're not breathing well at night and you've got some sleep apnea and you have a tendency to reflux, that can all kind of run together and you can get some inflammation of your vocal cords. One of the things I was in talking about reflux and how common it is. So, people a lot of times will come in complaining of a sore throat, but they don't have the classic strep throat, or they've been on antibiotics multiple times, or they may even point to their throat and say, something's stuck down here. I feel something stuck down here. That's called a globus sensation or a foreign body sensation. And so people that have that, and you look down the back of their throat and they're hoarse, and they feel that, and you look down there and there's not a mass or a tumor, this can all be from reflux, from inflammation. And so that is certainly one of the things that we always are looking for as well. And just to mention, this kind of struck me as I was talking to you, our voices tend to get worse as we get older, or not as vibrant as we get older. The vocal cords, the vocalis muscle, can tend to thin with age. So you can have something called presbylarynx, which is kind of an age-related change to the larynx. And a lot of times it doesn't happen when you're younger, but as you get older, your voice almost feels like you can talk in the morning, and then as the day goes on and the more you're talking, your voice tends to kind of get softer and go away. And so, that may be what's going on with your mom as well,
right,
as well as with radiation stuff that she's had before. But it can be a complicated diagnosis to try to figure out what's going on. Hoarseness is the symptom. What's actually causing it is what people want to know, and can you fix it?
Well, let's talk about some of the remedies for hoarseness. Are there some home remedies if it seems like a simple problem? And then at what point do I need to see a doctor?
The hey, I woke up with a cold and I'm hoarse. Certainly gargling with salt water, hot steamy showers, that kind of stuff really does help. Voice rest, those are the things that are easy to do. If you're refluxing a lot, there are a lot of the over-the-counter reflux medicines that certainly you can try. Things that are not getting better, especially if you're hoarse and having trouble swallowing, we really need to see you. Or somebody needs to take a look at you to make sure what's going on. The larynx, the voice box, it sits at the base of your neck. It's not an easy exam in the office. We either have to use a mirror to try to look down at your vocal cords, or put a camera in your nose to look down at your vocal cords, or in some cases, even if we really can't tell, sometimes we have to let you drift off to sleep to look down at your vocal cords as well. So it's a difficult area to examine. It's a complicated exam sometimes. And so most of the time things will get better if it's not a serious problem. But if it's not getting better, if you think it's a simple problem, it's not getting better, we need to look.
Great. When there is a more serious problem, what are some of the remedies that you would consider?
I think it depends on what the diagnosis is. First thing, especially with your mom, I think you were relating beforehand, they found it was a mass. If there's a mass or something down there, you need to image it. Then you need to maybe perhaps biopsy it. Other times, if it's an infection, sometimes you need to put people on antibiotics as well. And sometimes there are other things that are beyond the scope of what we're talking about right now, but you won't really know that until you start taking pictures and doing an appropriate workup.
And it sounds like there are cases when you might have to work with other doctors to solve the problem as well. Does that occur?
Certainly, especially in the case like your mom. She had a radiation oncologist, she had a surgeon, I think she had a medical oncologist, and so there are a lot of other doctors that are...
In the sleep apnea example, I'm sure you're working with somebody on that.
Correct.
Okay.
That's a great point too. One of the other things I wanted to bring up, sometimes when people come in, they're like, I feel something here, or I've got this hoarseness, and I can't tell whether stuff is coming down, whether stuff's draining down the back of my throat. Allergy, posterior nasal drip can give you a lot of hoarseness as well. So most of the time it's not something serious, but sometimes when it is, we do work to try to get that taken care of.
So at some point you want to tell people, don't wait. If you are having a recurring issue with hoarseness, they need to not wait.
Correct. I think it's one of those things where you give it a few days. If it's an acute problem, if it's a chronic problem, we're going to want to see you to take a look at it. And certainly if you're someone who relies on their voice, whether you're a singer or whether you're some type of professional where you need your voice to communicate, whether it's in the classroom or whether it's dealing in a business meeting, people are not going to really tolerate not sounding normally. They usually want to come in for an evaluation.
Right. So when the warm salt water gargling after a few days is not solving the problem, it's time to come see you.
Correct. One of the other things that I think is worth mentioning as well is, the voice box is a very complicated anatomical structure, and it is innervated by a lot of different nerves. There are nerves that give you control sensation of the vocal cords. There are nerves that control the pitch and the sound of your voice. And there's also nerves that actually control like how well your vocal cords move back and forth. And a lot of times when people come in with a complaint, whether they've lost their voice or they're not sounding right, it's not an anatomical problem in terms of a mass, but it may be a problem with how well the actual nerves are functioning. And a lot of times we get other physicians involved with that. Sometimes we have to have neurologists involved with that. Sometimes we have to have radiologists to help us take pictures to make sure that there's nothing wrong with the nerves that control the voice box as well. But in an area like this that is so complicated anatomically, one of the things that we always think about are neurological issues that can play a role in someone that's chronically hoarse.
Dr. Swain, can you talk about the role of speech therapy in strengthening the vocal cords?
Speech therapists are vital in terms of trying to help people recover from either certain illnesses or from cancer treatment or from inflammatory problems of the larynx and having swallowing problems. We work very closely with speech therapists. A lot of times the speech therapists are the ones that actually help people try to recover and regain function of their swallowing and speech mechanisms. They do that through a variety of means. Sometimes it's a matter of giving people exercises. Sometimes it's a matter of them sitting with you and explaining to you, okay, especially if you've had cancer or cancer treatment, how you're going to learn to relearn how to swallow or speak. So they play a vital role. They have a variety of different things that they use. Most people, unless you know a speech therapist, most people don't know where speech therapists work. A lot of times their first interaction with a speech therapist is after they've been in the hospital and they've had something happen and we're trying to figure out if they can swallow normally, and we'll ask a speech therapist to come in and evaluate how they're able to swallow. So they are certainly very important in terms of managing voice problems and speech problems.
So can they help a patient strengthen their voice?
Certainly. They give them exercises to do, and a lot of times it's helping their bodies learn to compensate for whatever change has been made, whether that's from radiation or surgery or illness or a variety of different factors.
Well, thank you, Dr. Swain, for today. And before our voices go hoarse, why don't we wrap it up? Why don't you tell everybody how they can make an appointment with you?
It's really easy to get an appointment to see me. If you would call and speak to my nurses, the direct line is 251-470-8823. Again, that number is 251-470-8823. If you call that number directly, my nurses can help you get set up to have an appointment to see me. And of course, we have appointments on the website. It's drronswain.com. That's DRRON Swain, SWAN.com for appointments as well.
Well, thank you so much.
Thank you, Stacy. I appreciate your time.
Thanks for listening to the Swain Sinus Show. Please subscribe to our show on iTunes, Overcast, and anywhere you download your favorite podcasts. Want to know more about Dr. Swain or to schedule a consultation or appointment? Visit SwainSinusShow.com or call his amazing nursing staff at 251-470-8823. We would love to hear what you think about the show. Email us at drswain@drronswain.com. Again, thanks for listening. Breathe easy and have a great day. This show is brought to you in part by the fine physicians and friendly staff at Premier Medical Group in Mobile, Alabama.